Somatic symptom and related disorders represent a complex category of psychological conditions where individuals experience significant physical symptoms that cause distress or impairment in daily functioning, often without clear medical explanations or with symptoms that are disproportionate to any underlying medical condition. These disorders highlight the intricate relationship between mind and body, demonstrating how psychological factors can manifest as very real and debilitating physical experiences. The classification encompasses several distinct but related conditions, each characterized by different patterns of somatic symptoms and psychological responses to these symptoms. The primary disorder within this category is somatic symptom disorder, which involves one or more somatic symptoms that are distressing or result in significant disruption of daily life. What distinguishes this condition is not the absence of medical explanations for symptoms, but rather the excessive thoughts, feelings, and behaviors related to these symptoms. Individuals with this disorder often experience disproportionate and persistent thoughts about the seriousness of their symptoms, high levels of anxiety about health or symptoms, and excessive time and energy devoted to these symptoms or health concerns. The symptoms may include pain, fatigue, gastrointestinal problems, neurological symptoms, or other physical complaints that significantly impact the person's quality of life. Illness anxiety disorder, formerly known as hypochondriasis, represents another significant condition within this category. Unlike somatic symptom disorder, individuals with illness anxiety disorder typically have few or no somatic symptoms but are preoccupied with having or acquiring a serious illness. They interpret normal bodily sensations or minor symptoms as evidence of severe disease, leading to excessive health-related behaviors such as repeatedly checking their body for signs of illness, frequent medical consultations, or conversely, avoidance of medical care due to fear of discovering serious illness. This persistent preoccupation with health concerns causes significant distress and impairment in social, occupational, or other important areas of functioning. Conversion disorder, also known as functional neurological symptom disorder, presents with one or more symptoms of altered voluntary motor or sensory function that cannot be explained by neurological or medical conditions. These symptoms may include weakness, paralysis, abnormal movements, seizures, speech problems, sensory loss, or other neurological symptoms. What makes this disorder particularly intriguing is that the symptoms are not intentionally produced or feigned, yet they often improve or resolve with appropriate psychological intervention. The symptoms frequently follow psychological stressors and may be inconsistent with known anatomical or physiological patterns, though they cause genuine distress and functional impairment. Psychological factors affecting other medical conditions involve situations where psychological or behavioral factors adversely affect an existing medical condition by influencing its course, interfering with treatment, or posing additional health risks. This diagnosis recognizes that psychological factors can significantly impact physical health outcomes, whether through stress affecting immune function, anxiety interfering with medication adherence, or behavioral patterns that exacerbate medical conditions. The psychological factors must be judged to have influenced the medical condition, and the relationship between these factors and the medical condition must be clinically significant. Factitious disorder, while related to somatic symptoms, involves the deliberate production or feigning of physical or psychological symptoms, with the primary motivation being to assume the sick role rather than to obtain external rewards. This disorder can be imposed on self or others, with the latter involving a caregiver who deliberately produces symptoms in someone under their care. The deceptive behavior continues even without obvious external rewards, distinguishing it from malingering, where there are clear external incentives for symptom production. The development of somatic symptom and related disorders involves complex interactions between biological, psychological, and social factors. Biological vulnerabilities may include genetic predispositions to anxiety or depression, altered pain processing, or heightened sensitivity to bodily sensations. Psychological factors often involve cognitive patterns such as catastrophic thinking about physical symptoms, heightened attention to bodily sensations, or learned associations between physical symptoms and emotional distress. Social and cultural factors, including family attitudes toward illness, Cultural expressions of distress and healthcare experiences also play crucial roles in the development and maintenance of these conditions. The impact of these disorders extends far beyond the individual experiencing them, affecting families, healthcare systems, and society as a whole. Individuals with these conditions often seek frequent medical consultations, undergo numerous diagnostic tests, and may receive unnecessary medical procedures, leading to increased healthcare costs and potential iatrogenic harm. The persistent nature of symptoms can strain relationships with family members, friends, and healthcare providers who may struggle to understand or respond appropriately to the individual's distress. Treatment approaches for somatic symptom and related disorders require integrated care that addresses both psychological and physical aspects of the conditions. Cognitive behavioral therapy has shown particular effectiveness in helping individuals develop more adaptive ways of interpreting and responding to bodily sensations, reducing catastrophic thinking patterns, and improving coping strategies. Mindfulness-based interventions can help individuals develop a different relationship with their physical sensations, reducing the distress associated with symptoms. Psychoeducation about the mind-body connection helps individuals understand how psychological factors can influence physical symptoms without dismissing the reality of their experiences. Medical management focuses on symptom relief and functional improvement rather than pursuing extensive diagnostic workups for unexplained symptoms. Healthcare providers must balance thorough evaluation to rule out serious medical conditions with avoiding unnecessary tests and procedures that may reinforce illness beliefs. Regular, scheduled appointments rather than symptom-driven visits can help reduce anxiety and provide consistent support while preventing the reinforcement of symptom-focused behavior. Family involvement in treatment is often crucial, as family members may inadvertently reinforce illness behaviors or struggle with their own frustration and helplessness. Educating family members about the nature of these disorders and teaching them how to provide appropriate support while avoiding reinforcement of maladaptive behaviors can significantly improve outcomes. The prognosis for somatic symptom and related disorders varies considerably depending on factors such as the specific disorder, severity of symptoms, duration of illness, comorbid conditions, and response to treatment. Early intervention and appropriate treatment can lead to significant improvement in symptoms and functioning for many individuals. However, these conditions often have a chronic course, requiring ongoing management and support rather than expecting complete cure. Understanding somatic symptom and related disorders requires recognizing that these conditions represent genuine suffering and impairment, regardless of the underlying mechanisms involved. The symptoms are real to those experiencing them, and the distress and functional impairment are significant. Treatment success depends on validating the individual's experience while helping them develop more adaptive ways of understanding and managing their symptoms. As our understanding of the complex relationships between psychological and physical health continues to evolve, approaches to these disorders will likely become more sophisticated and effective, offering hope for improved outcomes for individuals struggling with these challenging conditions.